Shoulder arthritis is actually a multitude of conditions that fall under the label of arthritis. The most common type of shoulder arthritis is what's known as osteoarthritis. Osteoarthritis is a condition of the joint where the normal lining of the surfaces, known as cartilage, is actually lost from the bone. And when you lose cartilage from the surfaces of the joint, it can develop into a condition known as bone on bone, and that can become quite painful. It's a condition that we typically see in patients who are older than 50 and tends to be progressive over time. Other types of arthritis include rheumatoid arthritis, and rheumatoid arthritis is a condition where there's an inflammation of the lining of a joint, and that inflammation can lead to destruction and loss of cartilage. There is a genetic predisposition to rheumatoid arthritis, and it usually happens in more than one joint at a time. A third type of arthritis that I will see not infrequently is something that we call post-traumatic arthritis. And post-traumatic arthritis, as the name implies, is usually related to an injury to the joint, such as a fracture or a dislocation. And the end result, it can be the same in that you have irregular surfaces that eventually lose their cartilage and you develop bone on bone. Once you have that type of condition in the joint, that creates a reaction in the joint of inflammation, and inflammation can be quite painful. In addition to pain, patients with arthritis often complain of stiffness because the abnormal surfaces don't move as well and the joint has a tendency to stiffen. They will also complain of catching or snapping or creaking of the joint, and again, these are all related to the fact that the surfaces are no longer normal. We treat shoulder arthritis similarly to the way we treat other arthritis in the body, and that is typically with medications such as anti-inflammatory medicines, and sometimes physical therapy can be helpful, particularly if the joint has stiffened. It tends to be more effective in patients with early arthritis as opposed to severe arthritis. In addition to therapy and medications, we will sometimes use a cortisone injection, and a cortisone injection can be effective at least temporarily reducing the inflammation of the joint. However, it's clearly not a long-term solution. So the indication for a shoulder replacement is a patient with one of these types of arthritis conditions that has led to pain that is no longer tolerable for the patient. And as I stated earlier, we will attempt to control the pain with various treatment modalities, physical therapy, medication, injection, that type of program for as long as we can. But at a certain point in time, the arthritis is severe enough that those treatment programs become ineffective. And patients with severe arthritis are really quite disabled in that they really cannot use their arm for any activities, including bathing and dressing and personal hygiene, and it becomes very difficult for them really on a daily basis, much less attempting to play a sport such as golf or tennis. Shoulder replacement surgery has been performed for the last 35 years very successfully. And as long as a patient has an intact functioning rotator cuff, it can be an extremely successful procedure. However, there is a group of patients who not only have arthritis in their shoulder, but they also can have a severely torn rotator cuff. And the rotator cuff is a group of 4 muscles that run from the shoulder blade to the upper arm, and they allow patients to elevate their arm. If a patient does not have an intact or functioning rotator cuff, then a shoulder replacement surgery will not be successful. In order to describe a reverse shoulder replacement, we'll take a look first at the model of the primary shoulder replacement. And what's not shown on the model here is that there are a group of muscles that are running from the shoulder blade to the top of the arm that allow you to elevate your arm. If those muscles are not present, such as a bad or severe rotator cuff tear, and you do a primary total shoulder replacement, this ball will just be pulled vertically and it will not allow you to elevate your arm because of the lack of rotator cuff. And up until approximately 2004 in this country, we had no good option for patients with arthritis and a severe rotator cuff tear. However, in Europe, for approximately 20 years, they've been using a different type of operation that is known as a reverse shoulder replacement for those patients who have arthritis and rotator cuff tears. The reverse replacement was approved for use in this country by the FDA in 2004, and thus we've been able to use this operation very successfully for this type of patient. So this is a model of a reverse shoulder replacement, and what you can see is that the ball has now been placed in the socket, which is this metal ball here, and the socket has been placed in the upper arm, and these can then mechanically fit together, and this is known as a reverse shoulder replacement. The advantage of this construct is that even though there's no rotator cuff, when the deltoid muscle pulls on the arm, because this is now constrained in this nature, the arm can elevate. So with a reverse replacement, the deltoid muscle actually takes over the job of elevating your arm, which it cannot do unless a reverse replacement has been put in place. Reverse shoulder replacement requires usually 2 days in the hospital, and it's an operation that's performed through a fairly small incision, approximately 3 to 4 inches in length. The surgery itself takes approximately 2 hours, and patients leave the hospital with a sling, but are undergoing exercises, mostly on their own for the first few weeks, to reestablish range of motion of the joint. Once they're out of the sling at 3 to 4 months after the surgery, they're beginning to resume activities of daily living, and most patients are able to regain the ability to raise their arm overhead between 4 and 8 weeks after the surgery. Patients who need reverse shoulder replacements typically cannot raise their arm even to the horizontal, and many patients significantly less. The tremendous gain achieved by having a reverse replacement and regaining the ability to lift one's arm is a huge success for these patients, and they're really very, very gratified with the operation.